few differences between an LN, or a licensed nurse, or a licensed practical nurse. In some places they're called licensed vocational nurses, so LVNs. A registered nurse, which is an RN, or a nurse practitioner, which is an NP. So we'll start here with the LPNs and the LVNs. So these nurses typically go through an 18-month training program, usually at a vocational school or community college or something like that. They can conduct basic patient assessments. So they'll be able to listen to heart sounds and lung sounds, that sort of thing. They can also administer some medications. This really depends state to state. So some states, they aren't allowed to give IV medications. Some states, they're not allowed to give narcotics. It just really depends on the state and what their guidelines are for the different nurses. As far as registered nurses goes, or RNs, these students have either an associate's or a bachelor's degree in nursing. So the associate is going to give you an ADN, bachelor's is going to give you a BSN. So that's either 2 or 4 years. So 2 years for the ADN, 4 years for the BSN. And these nurses can administer all medications. They can do all assessments. And the big thing with RNs is that they can take care of critical patients. So, whereas an LPN or an LVN, they can only take care of stable patients. The RN can take care of critical patients. And then, as we move up again, we're into the nurse practitioner role. So these nurses have either a master's or doctorate degree. So that's either 6 years for a master's or 8 years for a doctorate. So a doctorate is 4 years after your bachelor's degree. A master's degree is 2 years after your bachelor's degree, which is 4. So that's where that 6 and that 8 comes from. These can diagnose, assess, and treat patients. So in some states and a lot of states, they can write prescriptions. And they act as more of a provider. So they'll work, oftentimes, if you're a family nurse practitioner, they'll work in the outpatient setting. So think of that as your doctor's office, your specialist office, anything like that. They can be inpatient as well. Inpatient, they'll always work under the direction of a physician or a board-certified doctor. In the outpatient realm, they can function independently, and depending on what state, they can function independently and open their own practices too. So it really is just 3 different levels of nursing, starting here with your most basic to your most advanced. So we're starting here with the LPN, the most basic end, and then going all the way up to nurse practitioner, which is the most advanced.